If you're struggling with swelling and lymphedema in your genitals or pelvic region, follow along with me as I guide you through a complete lymphatic massage sequence. This specialized hands-on technique can help decrease the swelling and discomfort from lymphedema in the genital area. This is the third video of my 3-part video series on managing genital lymphedema. Keep watching until the end to get the first 2 videos on treatment options and exercises. I'm Dr. Alex Hill. I'm a board-certified physical therapist and a lymphedema therapist. I specialize in pelvic health and oncology. Let's get that fluid moving and out of that pelvic area. Manual lymphatic drainage, or MLD, is used to decrease the swelling from lymphedema. Before you start any type of new program, including MLD, always check with your medical provider first. There are a lot of different ways to do MLD, and what I'm showing you in this video is just one safe and effective way to do it. The goal of MLD is always to move the fluid out of the affected area, in this case, the genitals and the pelvic area, and move it back into the circulatory system. While you're doing MLD, if you feel shortness of breath, chest pain, dizzy, or something just doesn't feel right, stop immediately and you can contact your medical provider. To do MLD for the genital area, you can do this lying down, and you can also have folded blankets or pillows underneath your bottom, so it's going to lift you up a little, and that's going to help further drain that lymphatic fluid. If it's uncomfortable to lie on pillows or folded blankets, then you can just lie flat and have your legs supported. As you do MLD, it's important to do very slow and intentional movements to help have the best effects and benefits for this treatment. All right, so for the lymphatic massage, go ahead and get into a comfortable position with a pillow under your head, and then you can have a pillow or folded blanket under your bottom. That's going to lift the hips and help with bringing that fluid and draining it out of the pelvic and genital area. The first part of the lymphatic massage is going to be diaphragmatic breathing. That means that you're breathing in through the nose, really filling up the chest, ribs, and abdomen, breathing out through the mouth. As we do this diaphragmatic breathing, if you get dizzy, go ahead, just breathe normally. And if you have pain or discomfort pressing into the abdomen, then you don't need to press in, just do that diaphragmatic breathing. So go ahead and place both hands over your belly button. You're going to breathe in through the nose and out through the mouth, giving that little bit of pressure down. We're going to do this 5 times total. Go ahead, breathe in through the nose and out through the mouth. A little bit of pressure downwards into the belly button. Breathe in through the nose and out through the mouth. Breathe in through the nose, out through the mouth. And one more time, in through the nose, nice big breath in, and out through the mouth. The next part, we're going to massage at the neck. So this is going to be just behind the collarbone, and you're going to use the pads of your fingers. Make sure your fingers are together, and you're going to do circles right behind the collarbone, and you're going to do that 5 to 8 times. This is the last place the fluid goes to before it gets back into the circulatory system, and so we're stimulating that area, again, just behind the collarbone, 5 to 8 times. And then next, what we're going to do is we're going to start to work our way down the body. So because we have swelling in the pelvic or genital area, we want to move that fluid to the lymph nodes in the groin and also to the lymph nodes in the armpit. So we're going to be bringing that fluid out and up. So just remember that as we do this lymphatic massage, if you forget what you're doing, always remember out and up. So we're gonna start on my right side. You can start on either side, but you're going to put the pads of your fingers together, and you're going to place your hand in your armpit, right where you have hair growing or you put deodorant, and you're going to do 5 to 8 circles. You'll see that I'm doing this over my shirt, but when you do this at home, it's best to do it skin on skin. That's what's going to give you the best traction and the best effectiveness for doing this exercise. You'll also notice, again, I'm doing these movements very slow, very rhythmical. You want to make sure you're keeping slow movement as you do this lymphatic drainage. So again, at least 5 to 8 times for each of the areas that you're working on. After we wake up those lymph nodes in the armpit, then you can go down to the groin. So this is going to be right at the hip crease, or where you'd have an underwear line right here. You're again going to take pads of your fingers. You can even place the whole palm of your hand at the groin. And again, you're going to do those 5 to 8 circles. And best to do this again, skin on skin, but this is a YouTube video, so I need to keep my clothes on for it. So do the skin on skin at home and you'll feel the difference with it. You want to make sure you're getting good traction on your skin. After you do that, 5 to 8 times, we've primed the lymph nodes on one side. Then we're going to actually start going and moving the fluid from the groin up to the armpit lymph nodes. So to do this, you're going to take your hand, fingers together, keep a soft hand. So you don't want a super rigid hand. You want to make sure that it's kind of softened. You're going to work your way from the groin and from the hip, and you're moving that fluid up to the armpit. So the fluid goes where you move it. You don't want to be moving it in towards the abdomen or the chest, because you're just going to be bringing that fluid in. So taking your hand flat, you're going to do little sweeps going up to the armpit. This should take you 3 to 4 sweeps or pumps to get all the way up there. We're not doing one single sweep. We're pumping and moving that lymphatic fluid up to the armpit. Again, I want you to do this skin on skin at home to get better results. And you're doing that again 3 to 4 times going up the side, but you're going to repeat that at least that 5 to 8 times, just like we did for the lymph nodes. Now, if you have a hard time reaching across, then you can use something like a dry brush that has a handle on it. This is a really soft brush that you can use, and you're just going to hold it in the opposite hand, and you're going to do those same sweeps coming all the way up. I prefer hand on the skin versus using a dry brush. You're just going to be able to get a little bit better traction and surface area. But again, these dry brushes are really helpful if you have a hard time reaching all the way across. I do have this linked in my Amazon storefront that you can find in the link in the description below. So after we finish moving that fluid up the left side, we're going to repeat everything we just did on the other side. So you're going to take your hand, fingers together, and you're going to do those same circles at the armpit on the other side. Again, you're going to do that 5 to 8 times at least. You can certainly do it more, but at least 5 to 8 times to get those lymph nodes stimulated. And then after you work on the lymph nodes at the armpit, then you're going down to the groin at the hip. So again, this is going to be right in the hip crease. Take your hand, place it at that hip crease, and you're doing circles here at the groin. Again, 5 to 8 times. And nice slow movements as you're doing those circles. You want to stay right in that area where that hip crease is. That's where all those lymph nodes are at. After you do that 5 to 8 times, then we are going and moving that fluid up the side of the trunk. So again, make sure that you're not bringing it in towards the belly or in towards the chest. We want to bring it from the groin up the side to the armpit here. So you're going to start and pump that fluid up the side of the trunk. Again, it should take you about 3 to 4 times to get from the groin out to the hip and up the side of the trunk. And that's what you're repeating that 5 to 8 times, going all the way up. Again, if you have a hard time reaching, then you can always use the dry brush and you're sweeping it out and coming all the way up and making sure that you're using soft, slow sweeps coming all the way up. Again, I prefer hand on the skin versus the dry brush, but this is a great option if you have a hard time reaching across. And after we finish moving that fluid out and up to the armpit, then we can start working on the lower abdomen and the lower pelvic area. So I folded my shirt so that it is in line with the front of my pelvic bones here, and also my pubic bone, which is right here. Imagine that there's a line all the way from the pubic bone up to the belly button. Everything on the right goes to the right, everything on the left goes to the left. So you can do this one side at a time, or you can do them both at the same time. So again, ideally you do this skin on skin, not over close. So I'm gonna bring my shirt up so you can see a little bit better. So you're, again, going to keep fingers together. You're going to use the whole hand surface. Your fingertips are going to be at your pubic bone. You're going to think of little C's or rainbows, and you're bringing that fluid out to the groin and to the lateral or outer part of your hip. So again, this is gonna take maybe 3 or 4 times coming out to the sides. And that's what you're repeating those 5 to 8 times at least. If you have swelling in the pubic area here, the lower abdomen, you can certainly spend extra time more than just that 5 to 8 times. So you're coming, again, little C's or rainbows out to the groin and to the hips. Because remember, we had all that pathway to come all the way up to the armpits. So again, I like to do this at the same time, just saves you a little bit of time as you do both. And again, you want your full contact of the hand on the lower abdominal area, bringing that fluid out to the sides. So after you've done 5 to 8 times of those rainbows, really getting that fluid moving out to the sides, away from the midline, away from the pelvic area, then we're actually going to do the genitals. So now it's time to actually work on the genitals. I'm going to show you techniques for the vulva first, and then I'll show techniques for the scrotum. So for the vulva, you're going to take the pads of your fingers and gently make small C's or rainbows going up and out. You'll start up top towards the pubic bone, and then you're going to work your way down. You're going to work on one side first, and you're going to, again, do that at least 5 to 8 times. And then you can work on the other side, again, making those C's coming up and out, away from where you have that swelling at, working your way all the way down. You can also, if you're able to, do them both at the same time and just work kind of one side and then the other side. For the scrotum, it's going to be the same thing. So you're going to start from the top towards the pubic bone and then work your way down. You're going to use the pads of your fingers, make sure that they're together. And you're going to, again, kind of cup and move that fluid up and out. You don't want to be doing a whole circle because you're just going to bring it right back down. So you're bringing it up and out, working your way down to the bottom of the scrotum. And then you're going to work on the other side. So you're still working on the right and left sides. You can also do this at the same time, working on both sides, so right and then left, and working your way going down the scrotum. If you also have swelling at the penis, then you can take your hands and your fingers and you're going to gently massage backwards, because again, we're trying to move that fluid from that area back into the system. And so you're going to move that fluid and massage it back. So again, scrotum, we're going midline and moving it up and out, both sides. And then at the penis, then you want to make sure again that you're getting all around the penis and moving it all the way back towards the body. All right, so now that we've finished the genitals, we're going to repeat everything else coming back up to the armpits. But instead of doing 5 to 8 times, now we just need to do everything 2 to 3 times. So you've finished the genitals, we're going back to those C's at the pubic area. So you're going to, again, move those C's out to the sides. We're gonna do that 2 or 3 times. going out to the sides. Here's the third time. And then you're going to move that fluid up the side of the trunk. So we've got 1, 2, 3. We're moving it out and up. Might take you 4 times, that's okay. We're just making sure that we're pumping that fluid out and up to the armpit. And then we're gonna do the same thing for the other side. Again, make sure you're doing this skin on skin, get the best effects from it. All right, and then here's the third time, moving it up to the armpit. And then the last thing we're gonna do, we're gonna finish off with some diaphragmatic breathing. So go ahead and put your hands over your belly button. You're going to breathe in through the nose, out through the mouth, a little bit of pressure. Breathe in through the nose, out through the mouth. And one more time, breathe in through the nose and breathe out through the mouth. All right, excellent job. A little side note, if you feel like you have to go to the bathroom and pee more after you do this massage, that is totally normal. You moved a lot of fluid in the body, so it goes back into the circulatory system, and some of that you pee out. You can do the manual lymphatic drainage once or twice a day and do it at a time of day that's convenient for you, that will be most likely that you'll do it consistently. Most people do it in the evenings, once a day's kind of slowed down a little bit. I hope that this full routine for manual lymphatic drainage of the genitals was helpful for you in your treatment journey. Check out the videos on the end screen of this video for more videos on genital lymphedema treatment and exercises. Thanks for watching. Make sure to subscribe, turn on those notifications for more videos on how to manage your lymphedema.